Etoposide is a medication that is used to treat specific types of lung cancer, such as small cell lung cancer. It works by slowing down the growth of cancer cells. It is important to take this medication as directed by your doctor. The dosage and timing of the medication will depend on your specific condition and medical history, so be sure to follow your doctor's instructions carefully. When taking Etoposide, it's important to follow your doctor's instructions. This medication can be taken with or without food, and the dosage will be determined based on your medical condition and how you respond to treatment. It's crucial not to increase your dose or use this drug more frequently or for a longer period than prescribed. Doing so will not speed up your recovery and can increase the risk of side effects. While using Etoposide, it's best to avoid consuming grapefruit or grapefruit juice unless your doctor or pharmacist has advised otherwise. This is because grapefruit can interfere with the removal of Etoposide from your body, which may impact its effectiveness. If you have any questions about this, be sure to ask your doctor or pharmacist for more information. Additionally, it's important to note that Etoposide can be harmful to an unborn baby if it is absorbed through the skin or lungs. Therefore, women who are pregnant or may become pregnant should not handle this medication or breathe in the dust from the capsules. Some common side effects of Etoposide include nausea, vomiting, loss of appetite, and diarrhea. To help manage these side effects, your doctor may prescribe medication or recommend eating small meals and limiting activity. Temporary hair loss and sores in the mouth and throat may also occur, but these should improve after treatment. It's important to be aware that Etoposide can lower your ability to fight infections, so be sure to contact your doctor if you experience signs of infection such as a sore throat, fever, or chills. While serious side effects are possible, the benefits of using Etoposide have been determined to outweigh the risks for many patients. However, be sure to seek medical attention if you experience any serious side effects, such as numbness in the arms or legs, sudden vision changes, or difficulty swallowing. It's rare, but a serious allergic reaction to Etoposide can occur. If you notice symptoms such as a rash, swelling, difficulty breathing, or a fast heartbeat, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor if you notice any other unusual effects. If you're taking Etoposide, you should be aware that it can cause some serious blood and bone marrow issues, such as low red blood cells, white blood cells, and platelets. This can make it harder for your body to stop bleeding or fight off infections. If you start feeling unusually tired, notice signs of infection like a persistent sore throat or fever, or experience easy bruising or bleeding, like black stools or bloody vomit, be sure to let your doctor know right away. If you are using Etoposide, it's important to let your doctor know if you have any allergies, as this medication may contain inactive ingredients that could cause allergic reactions. Before starting Etoposide, also inform your doctor about your medical history, especially if you have kidney or liver disease, or any blood problems. Etoposide can increase your risk of getting infections or make current infections worse, so it's best to avoid contact with anyone who has a contagious infection. It's also important to let your healthcare professional know that you are using Etoposide before receiving any immunizations or vaccinations. Be cautious with sharp objects and avoid contact sports while using Etoposide to lower the risk of getting cut, bruised, or injured. Limit alcohol use, as daily alcohol consumption may increase the risk of stomach bleeding. If you are an older adult, be aware that you may be more sensitive to the side effects of this drug. Etoposide can affect fertility in both males and females, so it's important to discuss this with your doctor before starting treatment. If you are pregnant or planning to become pregnant, it's crucial to use reliable forms of birth control during and after treatment, as Etoposide may harm an unborn baby. This medication can also pass into breast milk, so breastfeeding is not recommended while using Etoposide. Remember to always consult your doctor or pharmacist before starting, stopping, or changing the dosage of any medications. It's important to keep a list of all the products you use, including prescription, non-prescription, and herbal products, and share it with your healthcare providers. This will help them determine any potential drug interactions and reduce the risk of serious side effects. Be sure to follow your doctor's approval when making any changes to your medication regimen. If someone takes too much etoposide and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with others. Your doctor may also require you to undergo lab tests and medical checkups, such as complete blood cell counts and kidney/liver function tests, while you are taking etoposide. Make sure to keep all your medical and lab appointments and consult your doctor for more details. When taking etoposide, it is important to follow the prescribed schedule for each dose. If you happen to miss a dose, consult your doctor or pharmacist immediately for a new dosing schedule. It is crucial that you do not take a double dose in order to make up for the missed one. Etoposide should be taken as directed by your healthcare provider to ensure its effectiveness in treating your condition. When it comes to storing etoposide, it's important to note that different brands of this medication may have different storage requirements. Be sure to check the product package for specific instructions on how to store your brand, or ask your pharmacist for guidance. It's crucial to keep all medications out of reach of children and pets to prevent any accidental ingestion. When it comes to disposing of etoposide, it's important not to flush the medication down the toilet or pour it into a drain unless instructed to do so. Instead, be sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.